Ozempic, semaglutide, the active ingredient, can still be working even when the dose looks small. If appetite is calmer, blood sugar is better, and side effects are manageable, increasing may add risk before it adds value. The real question is not, should you increase anyway? It is, what problem are you trying to solve with a higher dose before you change it? A dose increase sounds like progress, but medicine does not work like a video game level. More drug can mean more effect, but it can also mean nausea, constipation, reflux, dehydration, or trouble eating. The right dose is the lowest dose that meets the right medical goal safely. Many people judge the dose by the pen number. They think a small dose must be temporary, weak, or unfinished. But the body does not read the label emotionally. It responds through appetite, blood sugar, how fast food leaves the stomach, side effects, and how well you get through the day. Those body signals matter more than the pen number. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Ozempic belongs to a class called GLP-1 receptor agonists, medicines that copy a gut hormone signal. They help the pancreas release insulin when blood sugar rises. They also slow how fast your stomach empties, which can reduce hunger and make smaller meals feel satisfying. That is why a low dose can feel powerful. That does not make it magic. Your body may be sensitive to the signal. Smaller meals, quieter cravings, and better blood sugar readings mean the low dose may not be failing. The label still matters. Ozempic usually starts at a very low dose to help the body adjust. It then moves upward only when more blood sugar control is needed. The A1C test shows average blood sugar over months, and it often matters more than appetite alone. Be careful with the phrase low dose. A starter dose and a lower dose meant for ongoing use are not the same thing. The starter dose is mainly to help the body handle side effects. A lower ongoing dose may still be appropriate when blood sugar or weight goals are being met. Also, separate two goals that often get mixed together. Ozempic is prescribed for type 2 diabetes, and weight loss may happen during treatment. If diabetes control is the goal, blood sugar and A1C matter most. If weight is the goal, safety, approved use, cost, and long-term strategy matter. The next question is, which goal is not being met? That question creates two different situations. One person is on a low dose, eating normally, losing slowly, and meeting the main goal. Another person is also on a low dose, still high after meals, still hungry, or not making safe progress. Those are not the same situation. For the patient not meeting goals, increasing may help. But if the low dose is already helping, raising it may create problems instead of solving them. A higher dose can improve a lab number or scale number while worsening nutrition, constipation, and daily life. Better numbers do not automatically mean better care. That risk to nutrition matters before the next dose change. Losing strength, skipping meals, or eating very little protein can make raising the dose risky. The goal is better health, not just a smaller appetite. Protect muscle, drink enough fluids, and keep a normal routine. Side effects should guide the decision before the desire to go higher does. Mild nausea can happen during adjustment. Persistent vomiting, severe abdominal pain, inability to drink, faintness, or worsening constipation is different. Do not treat those symptoms as proof that stronger is better. This caution matters even more in older adults, people with kidney issues, or anyone taking insulin or sulfonylureas. Sulfonylureas are diabetes pills that can push insulin release. A sharp drop in appetite can raise the risk of low blood sugar with those medicines. Your doctor or clinician may need to review the plan. After side effects and diabetes medicine risks, appetite changes can make the dose look weaker than it is. Sometimes the dose only looks like it failed because the early appetite effect fades. Early fullness can feel powerful, then the body adapts. That does not always mean the drug stopped working. So hunger returning is not automatically proof that the dose failed. Hunger can return when you undereat, sleep poorly, lose muscle, or skip protein. First, ask whether hunger is a normal signal from your body. Then ask whether blood sugar or weight goals are not being met. A plateau does not always demand a higher dose. Weight can pause from temporary water changes, constipation, sodium intake, or reduced activity. Blood sugar can vary from stress, steroids, infection, or sleep loss. Increasing the drug may not fix the real cause. Also, check life changes around the same week. Travel, restaurant meals, alcohol, poor sleep, and a new supplement can change appetite, weight, or stomach symptoms. That history helps separate a dose problem from a temporary routine problem. A short symptom diary can make the pattern much easier to see. Before blaming the dose, check how the medicine is being used. Missed doses, inconsistent injection days, wrong storage, or removing the needle too early can change the result. Make sure the medicine is getting into your body the way your doctor instructed. A useful clinic visit needs specific details. Bring home blood sugar readings, current weight change, side effects, bowel movement pattern, appetite changes, and a medication list. That gives your doctor specific information, not guesses. Dose changes become safer when the decision is tied to measurable problems. The details you bring help because the dose decision starts with the health goal, not the label. Blood sugar records, A1C, weight change, symptoms, and routines show whether the current dose is solving the actual problem. For weight goals, a slow improvement can still be a good improvement. Fast weight loss is not automatically healthier. It can raise the chance of muscle loss, dehydration, gallbladder problems, and eating too little. The best result is not the fastest change, it is the change you can maintain. Then check daily function. Work, exercise, sleep, and normal routines should still be possible during treatment. If daily life is getting harder, a higher dose may make the wrong problem worse. After checking goals, side effects, correct use, and daily life, ask whether changing the dose would improve the plan. A low dose may already meet the goal with fewer side effects. A higher dose should solve a real problem, not prove that you can handle more medicine. The goal is enough benefit with fewer problems. If the plan needs a change, do not secretly space out, split, or change doses without talking with your doctor. These pens and schedules are made for set dose amounts. A dose that feels too strong or too weak needs a conversation with your doctor, not a home experiment. So should you increase anyway? Not increasing can be reasonable. The low dose may meet the goal, side effects may be manageable, and your doctor may agree. Increasing may also be reasonable when the goal is not met, side effects are controlled, and risk is acceptable. The best dose is not the highest dose. It is the dose that gives enough benefit without taking away normal life. Small can still be working. Bigger can help, but only when it solves a real problem. Dose should follow evidence, not impatience. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.